Hello, you're listening to Health Professional Radio with Henry Acosta. I'm Henry, and our guest today is Dr. Jayne Carberry. Did you know that more than 1 million Australians suffer from sleep apnea, and that is a very serious health issue? It can affect every little thing in our daily lives, from our daily routines to our jobs. So today, Dr. Jayne joins Health Professional Radio to talk about their new research. And Dr. Jayne's from NeuRa Sleep and Breathing Labs. So with all that said, welcome to the show, Dr. Jayne.
Hi, thank you very much.
So can you give us a little bit more background about yourself? How did you get involved with the research with regards to sleep apnea?
So I did I did my PhD actually in Ireland, and I was looking at upper airway muscles, how they transition during development, and what happens to them when they're exposed to high altitude. So part of our lab actually looked at animal models of sleep apnea. So I had a bit of a background on sleep apnea, and I guess the upper airway muscles are kind of crucial in keeping the airway open. So when I came to Australia, I met up with Associate Professor Danny Eckert, and he was setting up a sleep lab at NeuRa, and he asked me did I want to be involved, and so we started with a one-bedroom facility in NeuRa, and then expanded to 3 bedrooms over the last 5 years. So it's been pretty good.
Yeah, and can you tell us what sleep apnea is?
Yeah, so sleep apnea, it's a breathing disorder that occurs during sleep. So it's characterised by closure or narrowing of the airway. So the walls of your throat, so from, say, the back of your nose to your throat, these regions can close or narrow during sleep. And this can occur from, say, in mild cases, 5 times an hour, but for severe cases, it can occur up to 100 times an hour. Wow. Or even more. So it can be quite disruptive to sleep. So some people wake up every time they have an event. Other people don't really realize they're having as many events as they are. And these events can also last for up to 10 seconds. Well, they last from 10 seconds up to a minute or more. So this can lead to reduction in blood oxygen levels as well, and which will have consequences for cardiovascular system as well.
With regards to that, how do people usually find out they have sleep apnea, and how do they get it?
So symptoms of sleep apnea. So some people might be really loud snorers. They may notice that they stop breathing during the night. There's also reported kind of like a gasping or choking sound. Usually it's easier to have a feedback from a bed partner when they say, oh, you stopped breathing last night, you're gasping or choking, and that's kind of a key indicator that it's sleep apnea. Another issue is that your sleep is very disturbed. So the next day, people are excessively tired. They feel very unrefreshed, and they want to sleep, take naps during the day. Also, people may be quite moody or grumpy, and it has consequences for alertness. And there's a major increased risk for motor vehicle accidents as well for people with excessive sleepiness. So, in terms of causes, well, there are 4 main causes of sleep apnea. One of them is anatomical, and this is it involves having a narrow or crowded, inherently more collapsible upper airway. So this might be due to enlarged tissue structures in the airway, so an enlarged tongue or enlarged tonsils or adenoids, but also people who are overweight. This can impinge on the airway. And, if someone has a large abdomen, when they lie down, they're pressing on their lungs, and it might affect them as well. So that's one kind of cause that people have to some degree, to varying degrees. And then there's 3 other contributing factors, and they're non-anatomical causes. So one of them is waking up too easily. and we call this having a low arousal threshold. So when someone's airway is narrowing, they increase their effort to breathe, so the pressure in their airway is increasing. And these people, they're just too sensitive to that change in pressure. So they wake up to really low levels of pressure in the airway. And this stops them from getting to deeper stages of sleep where breathing, say, is more stable, and also stops them from building up drive to recruit their muscles to try and keep the airway open. So about 30% of sleep apnea patients have this low arousal threshold. Another cause is, say, ineffective or impaired upper airway muscle activity. So there are lots of muscles in the upper airway that keep the airway open. One that we're particularly interested in is the genioglossus, so that's the base of the tongue. And this muscle protrudes forward and widens the airway, so it's a dilator muscle. And it's thought that, again, about 30% of people have reduced muscle activity during sleep, and this contributes to their sleep apnea. And then another cause is unstable ventilatory control. So this basically means that people are too sensitive to changes in carbon dioxide levels. So it can lead to kind of vicious cycles of unstable breathing periods and apneas. We're interested in looking at kind of personalizing therapy to target those individual traits rather than the standardized one-size-fits-all treatment approach that's currently being used.
Yeah, that totally makes sense. With regards to how many ways there are to cause sleep apnea, it's really important to have a personalized treatment with regards to that. And what do you think? How are you guys going to treat sleep apnea?
Yeah, so I'll just give you a bit of background on the current treatment. The current treatment, it's the primary treatment, is CPAP therapy. I'm not sure if you're familiar with this, but it's continuous positive airway pressure, and it involves wearing a mask or a device that splints the airway open. And it's a really effective form of treatment for sleep apnea patients. However, there's quite a high failure rate with it. Some of it's due to the cumbersome nature of the device. Some of it's due to bed partners, and another reason is adherence. So a lot of people try CPAP, they fail, and then they just remain untreated, or they might try a different therapy and not have as a successful outcome as they would have if they had continued on CPAP. There's an oral appliance. It's a mandibular advancement splint, so it's sort of like a mouth guard, and you put it on your teeth, and it pushes the jaw forward. And this can, again, be effective for some people. The problem with this is that it's hard to predict who will respond to treatment from this mask device. So we're interested. Some of the research at NeuRa, we're interested in better understanding who will respond to this oral device. And one of the other areas that we're interested in is targeting the muscles. So if people who have poor muscle activity, if we can, say, give them muscle training, so this might be different forms of exercises to strengthen the muscle, can we improve their muscle activity during sleep, and will this contribute to a better treatment outcome for them? We're also looking at pharmacological agents that target the muscle to try and increase the activity of the muscles. And another study, we've been looking at sedatives and trying to see whether for the people who wake up too easily, can we get them to that deeper stage of sleep without impairing other factors of their breathing to try and get them to so deeper sleep and then improve their sleep apnea that way. So we've various range of projects that we're we're looking at now, and it's all towards targeted therapies. And it might be a case that some people will need two forms of treatment, so a combination therapy. So they might need, the muscle training in combination with a mass device or something like that. So, yeah, it's a pretty interesting area for us to be working in at the moment.
Yeah, and for those people who live alone, what's the best way for them to actually find out if they have sleep apnea if they don't realize it?
Yeah, so with it being Sleep Awareness Week as well, I guess if you have any concerns that you're waking up a lot during the night, or if you know you snore, or if you feel you snore, if you feel really unrested the next day, or if you even have high blood pressure, it's probably worth talking to a GP and asking them, letting them know that you've concerns about sleep, and if they might run through some things with them, and then you might be referred to a sleep specialist. And after that, we would probably you would get a sleep study. So sometimes sleep studies can be carried out at home. Other sleep studies are carried out in a facility, and from that you would be able to get a reading of whether or not you have sleep apnea, and if or not you would require treatment from it. If you do think you have sleep apnea, or if you know you have sleep apnea and you've failed treatment and are untreated currently, you really should consider reassessing, because sleep disruption has implications for heart attack. There's an increased risk of diabetes, stroke. It can also impact on mental health, so increased risk of depression and anxiety. And again, as I said before, motor vehicle accidents. So, it's important that you do seek treatment if you suspect you might have it.
Yeah, and as you mentioned, it's Sleep Awareness Week. Can you tell us what we have to know about it?
Well, this is actually Sleep Awareness Week now. So, yeah, I guess it's a good time to reassess, but reassess your sleep and how you're feeling. And, I think, there's various different types of sleep disorders. So I focus on sleep apnea, but also there's insomnia and, say, restless leg syndrome and various other conditions. But some people just have bad sleep hygiene. I think as in this day and age, with the use of mobile phones in our hand 24/7, nearly laptops in bed, nearly a lot of coffee, I think it's probably a good time to think about habits and how to improve it and how to improve your sleep. So, try avoid using the phone in bed late. Have a bit of a break before you go to bed. Wind down. Don't drink coffee late. Try avoid napping as much in the day if you can, and try and get up at regular times and get out in the daylight and expose yourself to sunlight, and put sleep first. I think we're concerned of sleep is kind of pushed at the back of our work and social life, so it's important that during Sleep Awareness Week we reassess our situation and hopefully can improve some sleep. This is a big impact on the economy from sleep disorders. So, that's my advice for Sleep Awareness Week.
All right, well, thank you for that, and that's all our questions for today. Before we end the interview, I just wanted to ask, for anyone interested in knowing more about your research at NeuRa, what's the best way to get in touch with you guys and even learn more about sleeping conditions?
Yeah, so I guess with NeuRa, we have a Facebook page, a sleep and breathing Facebook page. So we usually keep up to date with the latest research that we publish, so people could look at that. We also have a NeuRa website with links to different studies that we're running. There's some information on sleep disorders. So that's neura.edu.au. And then if for anyone else, there's, I guess, the Sleep Health Foundation, if they want to have a look at that. There's some information on that website about various different sleep disorders, which might be helpful for people.
Awesome. Well, thank you so much for coming on the show, Dr. Jayne.
Oh, thanks for having me. Have a good day.
You have a good one too. And that was Dr. Jayne Carberry from NeuRa. We just finished talking about the serious health issue that is sleep apnea, that is affecting over 1 million Australians and a lot more people around the world. If you want to learn more about their research, you can go on neura.edu.au. That's neura.edu.au. And if you've missed this interview or you want to listen to it again, and if you're interested in learning more about fitness, medical research, and health news, you can find us on www.hpr.fm. We're active on all major social media platforms, so make sure to subscribe, like, and follow us on those. Our interviews are available for download on SoundCloud, YouTube, and iTunes. I'm Henry Acosta, and you're listening to Health Professional Radio.